This segment of Delmarva Life is sponsored by TidalHealth.
It is one of the hardest working muscles in the body, and February is when we bump it into the spotlight. February, of course, is Heart Month. Now, the good news is that you can take very easy and simple steps to help increase the strength of your heart.
Simply getting enough sleep, managing stress, and maintaining a moderate amount of physical activity can reduce the chances of being diagnosed with heart disease. So let's hear from the experts. We're here today with Dr. Ahmed Abouhaniyeh, the Medical Director of Cardiac Rehabilitation with TidalHealth. Welcome to Delmarva Life.
Welcome.
Thank you, Steve. Thank you, Lisa. Thank you for having me again.
So tell us, what are the three things that women should be concerned about for their heart health?
Yes, and I would summarize this in three major points. So know your risk, know your symptoms, and know your numbers. Basically, know if you have any condition that puts you at an elevated risk compared to your peers for having heart disease. Know your family history. That's really, really important. Then know your symptoms and be aware that women are not going to have the same symptoms as men. Women tend to have more vague of symptoms, so important to be aware of that. And finally, know your numbers and focus on prevention. Make sure that your sugar, your cholesterol, your blood pressure, they're all where they should be.
Okay, let's go back to those vague symptoms for women. What are they?
So in women, as I said, they can still have the classical chest pain, but they're more likely to have kind of like maybe dizziness, maybe it's nausea, maybe she would feel that she's extremely fatigued, which is unlike her usual self. And unfortunately, Lisa, there has been a lot of studies that actually did show women tend to have delayed care because their symptoms are either brushed off as something non-cardiac or they don't even seek care immediately because they think this is nothing.
Yeah.
So we all track a lot of different numbers, our sleep numbers, as we were talking about before we got on the air. What numbers should people really be concerned about when it comes to their heart?
When it comes to the heart, it's mainly about prevention. And by prevention, I'm talking about the three silent killers. So diabetes, high cholesterol, high blood pressure. When it comes to high blood pressure, the number we should all aim for, the optimal number, is a blood pressure of less than 120/80, and both numbers should be less than that. Until the 130s, you're at risk, but I mean, you could be fine. Anything more than 130, you should really see a doctor and probably get started on a medication. For cholesterol, again, the optimal, the number we like to see is less than 100. Anything more than that, we start talking about your diet, your exercise, maybe put you on medications if that didn't work. And then for diabetes or your blood sugar, try to keep your fasting sugar less than 100. Again, this is all optimal and it's way easier said than done, but we should aim for greatness and then do our best.
And as you mentioned, family history is a big part of it as well. So who should we be talking to? I mean, where should we get this? I mean, distant aunts and uncles or mom and dad?
That is a great question, Lisa. And mainly we're talking about first degree relatives, so parents, siblings, but also second and third degree. And we're mainly interested in family history of early or premature heart disease, we call it. So if you have a family member who had their first heart attack before the age of 55 in men or before the age of 65 in women, that really increases your risk of having a heart disease because there could be some genetic component of what's going on. One very important question we ask in the cardiology offices, do you have history of sudden death in the family? Because there is a lot of conditions that are genetic and they have such peculiar presentations that a simple question or a simple piece of history would give us a lot of idea about what's going on.
So what kind of advice will you give your patients or your heart patients concerned about their heart health?
So as I said before, know your numbers, make sure that you're focusing on prevention. If you already had cardiac diagnosis or a heart attack, know that the greatest risk for a heart attack is a previous heart attack. So this should serve as a wake-up call in order to adopt a healthier lifestyle, to follow regularly with your doctors, to be compliant with your medications, and to overall adopt a healthier lifestyle.
All right. Good information. Thank you so much for coming in, Dr. Ahmed Abouhaniyeh with TidalHealth. Thank you.
Thank you, Lisa.